Welcome back to Sketches in Surgery. In this particular video, we're going to talk about the neck, and we're going to break the neck down into three components. We're going to talk basically from the bottom up. This video will be about the deep neck, and we will take that as layer one. That's the deepest part of the neck in a neck lift, facelift. The second layer, which will be a second video, will talk about the middle layer, which is the platysmal layer, and then the third layer, which is the superficial layer. We'll talk about the skin and the fat. So in this particular video, we're going to look at what factors can influence the neck. So we will zoom in down on this picture here at the bottom. And as you can see, we got all kinds of structures. And let me see if I can zoom in. Perfect. So this is a cartoon drawing of a neck. It's a little exaggerated. Let's kind of orient ourselves here. Nose, lips, chin, kind of this obtuse, full neck. Now, a lot of people see this kind of with, the normal skin covering, of course, and think this patient has a lot of fat. And that may be true, but again, we're going to focus on the deep neck here, and we're going to talk about the structures that can produce a full-looking neck that can be modified with surgery and sometimes can't be modified with surgery. So let's focus on the structures we have here. Let's start from the bottom up. Right here we have the Adam's apple, or the thyroid cartilage, which doesn't really have a strong influence in facial aesthetic surgery when we're speaking directly about facelift, but you can do various procedures on the thyroid to soften it in feminization procedures from male to female that can change the contour of the neck. But we're going to focus on this structure here. This little kind of saucer looking structure is going to be our hyoid bone, and it has the attachment of many muscles, but we're going to focus in on this muscle right here, which is kind of this V-shaped muscle, and I've really kind of over illustrated it. It's called the digastric muscle. It has a front belly, and that's what sometimes we call muscles, like our own belly. But this belly is the anterior belly, and this is the posterior belly. So we're going to look at that. We're going to look at this little triangle, and in this triangle lives a couple of things. There lives the submandibular gland, or portion of it, and you can see it kind of illustrated here with these little bubbles that are orange. And then if you get a hint, and I'll try to really zoom in, you get a hint that these little dots here, that's the submandibular gland. It kind of wraps around the border, a lower border of the jaw, or the mandible. So what we kind of evaluate is that portion that's superficial, or the portion that's can be felt or seen just below the border of the lower jaw. Also in this kind of triangle, you have this reddish structure, which is the facial artery. You also have this bluish structure, and I wish I had yellow, but this bluish structure represents two branches of the facial nerve. These are nerves that give you kind of animation to your face and neck. This lower branch is called the cervical branch. It sometimes is encountered in the neck lift. It'd probably be more discussed in my second video when we're talking about the middle layer, or the second layer, which involves the platysma. But also in this particular deep layer, you can encounter the marginal mandibular branch, and that's kind of the feared branch. Why is it the feared branch? Because if this branch is irreparably harmed or damaged permanently, or even damaged temporarily, it can cause great anxiety to the client, patient, or the doctor if they're inexperienced, depending on what they know happened during the operation. This nerve gives you kind of tone to your lower lip and chin. So if this is damaged permanently, you can have kind of a droop to the corner of your mouth where you look like you've kind of suffered a stroke, or you're kind of like Sylvester Stallone, and you're like Adrian. They got this droopy kind of corner that doesn't function evenly from side to side. So we need to be wary of that. As you can see, that crosses into this triangle, and it crosses that artery, and it crosses, depending on where you are, you have to know the anatomy of the submandibular gland. It crosses the submandibular gland. So these structures, particularly the submandibular gland, the digastric muscles, and the hyoid bone, contribute significantly to the anatomy of the neck. These other structures are critical structures that your surgeon, your plastic surgeon, should know the location, know the anatomy, as not to injure these structures. So, with that being said, let's kind of take a 30,000-foot view. As you can see, this person has really not a very sharply defined neck. This can be influenced by the position of the hyoid bone. The hyoid bone can position in what I term a low hyoid bone, and it's not my own terminology. This is known terminology. Hyoid bone is low, and so the lower that is, the less sharp or more rounded this portion of the neck is. The higher that is, the sharper that neck can look and will look, initially. So you got to recognize what the limitations are in this particular patient. Someone with a low hyoid bone, they're really not going to have, as a result, no matter what you do, a really sharp neck. They're not going to have that. They're going to have some improvement, but you have to warn them, because of the position of this bone, that they'll have improvement, but it won't be this really angular, kind of right angle neck. Someone who has a higher hyoid bone, then they can achieve that really clean right angle look if the procedures are performed expertly and the right procedures are chosen for that particular person. So, with that being said, we got to understand the position of the hyoid bone first and foremost. Once your surgeon, your plastic surgeon, understands that, then he or she may look at the digastrics. And it's hard to look at the digastrics during a consultation. That's not something that in my 20 years of experience that you can just readily appreciate, every time. You might consider that as part of your surgical treatment, but that's not something that you can really zero in on. But, the submandibular gland, especially this kind of lateral or superficial lobe, and glands are divided into lobes. This is a superficial lobe, and behind the mandible is the deep lobe. This superficial lobe can be appreciated. Someone has a really loose skin, or maybe a regularly positioned hyoid bone, or even high, and you kind of simulate this by pulling the neck back, and you still see this little bulge no matter how much you pull. That's not fat, that's not loose skin, that can be and probably is the superficial lobe of the submandibular gland. So when performing a neck surgery as part of the facelift procedure, this gland needs to be removed. This portion of the gland. You don't remove the deep portion, and you try to stay away and appreciate the location of the facial artery and this marginal mandibular nerve as not to injure them. So this needs to be cleaned up so that you don't have, and we've all seen it, these necks that look pretty clean, but they've got this little bulge right here. So it doesn't make them look pristine or 100% clean. So we want to appreciate this and want to talk to our clients when this is appreciated or suspected to be a culprit in giving, lack of contour to the neck, that this needs to be addressed. In surgery, this is where you can address the geniohyoid, the anterior belly of the digastric, the anterior belly digastric, and you can remove part of this digastric that may give you fullness in the front part of the neck. You've treated the skin, you've treated the platysma, which is the superficial muscle, you've treated the fat, and you still have this fullness. You may have to partially remove part of the anterior belly of the digastric. So in this particular patient representation, how can we treat this neck? So let's say we've treated the skin, we've treated the platysma, and we still don't have the cleanness and the definition that we want, even in this low hyoid. What we may want to do through a submental incision, and I'm going to zoom in a little bit, back myself out. Through this submental incision, I'm going to make it pretty generous. Submental incision. What we may need to do is we may need to shave a bit of that shave a bit of that muscle down. Not the whole thing, just shave a bit of that muscle down for sure. And really thin it down. And then we may need to come to the gland and we need to resect or remove that superficial gland. Trying to clean that up a bit and not to injure those structures that we talked about. So you can kind of really kind of clean this and hollowness just beneath the mandible or lower jaw so that we can really get that anatomy that we desire. So we've cleaned out the neck here with removal of the superficial portion of the gland. We've shaved down this digastric muscle. We can't do anything about the hyoid. We can't reposition it. It's too important and has so much function and stability of the muscles of the floor of the mouth and of the swallowing mechanism. So we can't really do that. So we're kind of bound to that. So what can we do then? We've treated the other areas. Then we just hopefully get a better contour to our neck. And I'm going to back out here, I believe, because it's going to give me the best view of the draw. So once we've done that, we have a better contour to the neck. So again, this is not a neck that looks like, and this is a pretty good neck, but it doesn't look like that. It's not that, but it is this, and that's pretty dang good from where we started. So you need to address that. Definitely need to address that so that you can really get the anatomy you want. So again, this is a brief video about the deep portion of the neck in the neck lift and facelift. I hope that you can understand and appreciate what I tried to present here, that it's helpful if you're looking for an excellent plastic surgeon to treat your aging face and neck. This surgeon should understand these tenets and should be able to understand the anatomy to help you achieve your ultimate goal. So again, just in summary, we need to look at, in the deep neck, we need to look at the submandibular gland, which is here, which may contribute to fullness. We need to appreciate the position of the hyoid bone, whether it's low or high. Can't really do anything about that, but appreciate it nonetheless and set expectation. And we may need to, once we're in surgery, address the anterior or the front belly of the digastric muscle, and we may need to contour that to help the contour of the neck. So I hope you enjoyed this video, and I have other videos on my sketches and surgery series about chin and about male breast contouring or chest contouring. If you need any type of plastic surgery and want to have a real conversation with a board certified plastic surgeon, I offer consultations here in Atlanta and virtually. Our consultation fee is $225. We spend a solid hour with you to make sure that all your questions are answered and that we arm you with information, so whether you decide to go with me or someone else or not to do anything at all, you know that you've got all the information or the right information to make the best decision possible. Again, thank you for viewing, and if you like videos like this, please like and subscribe and hit the bell icon so that you'll know when there are new videos. Until next time, thanks so much.